Good evening, Dr. Nisar Sonam Nisar. Thanks for coming to Healthabove60 panel. On behalf of our clients, we welcome you to the Healthabove60 panel.
Thank you so much. It is my pleasure to be here. Vanakkam ellarke. So, என்னோட பேர் டாக்டர் சோனம் நிசார் and நான் வந்து oculoplasty surgeon இருக்கேன் சங்கு நேத்ராலயில. இப்போ எனக்கு நம்ம 60 years மேலே what are the common eye problems, what are the common issues that elders face in the eyes, அதை பத்தி நம்ம இன்னைக்கு டிஸ்கஸ் பண்ண போறேன். So, இதுல common பிரச்சனை என்ன இருக்கும்? Most of the people above 60 years will come to the hospital with a complaint of diminution of vision. When the மேகமூட்டம் மாதிரி இருக்கும் கண்ணுல கொஞ்சம் மங்கலா தெரியும். So most of them will have age-related cataract. Cataract means pore. So cataract about 50 to 55 years are most prone to have age-related cataract. So other first and foremost most common problem here. Upon second common problem is what we call as glaucoma. Glaucoma என்ன இருக்கு? அது கண்ணுல pressure பிரச்சனை இருக்கும் और நரம்புல suppose blood supply கொஞ்சம் கம்மி இருக்கும் அப்போ கண் நரம்புல ரொம்ப டேமேஜ் ஆயிட்டு அது peripheral vision loss start ஆகும். So what is peripheral vision? Peripheral vision means normal நம்ம straight பார்க்கும்போது we can look at this angle and this angle almost 270 degrees நம்ம எல்லாம் கிட்ட தெரியும். வந்து கண்ணை முடிச்சிட்டு also they are able to have a good visual field. So அந்த glaucoma என்ன அந்த peripheral vision first damage ஆகும். So நமக்கு லாஸ்ட்ல தெரியும் நம்ம கண்ணுல ஏதோ பிரச்சனை இருக்கு. Okay, that is why we call it a silent killer. Okay, symptoms எதுவுமே அதிகமா இருக்காது. But those who are very vigilant enough will know that peripheral vision is going a little bit. So that is one thing. Third thing, what is most common? Nama retinale, because of age, retinal cells can damage. Also because of some eating habits and other food habits as well as smoking, nama retina cells damage. So because of that, we call it an age-related retinal macular degeneration. So other center vision nama first affect. You have a dry macular degeneration and a wet macular degeneration. So these are the most common problems that we face. And now the most emerging and the common problem is dry eyes. நம்ம கண்ணுல ரொம்ப இரிட்டேஷன் மாதிரி இருக்கு, கண்ணுல கொஞ்சம் தண்ணி வந்துட்டே இருக்கு. எதனால வந்துட்டே இருக்கு? Most likely because of dryness. Dryness க்கு நிறைய causes இருக்கும். We can probably discuss that as and when we come to the questions.
Yes, doctor, thank you. I think most of the questions you have started already. So initial question, what is cataract? That you already explained. Maybe now you can tell to the particular client what is generally cataract na enna.
So nama ellarku normal lens irukku kannilla. Okay. As and when nama age adikama appo as you see on the face also we have all aging signs like wrinkles, bags and everything. Similarly inside the eye also the aging changes are. So nama normal lens will the transparent irukku. Because in cataract the lens slow down translucent ஆயிட்டே opaque ஆயிட்டே இருக்கும். So lens age related changes வந்துட்டே இருக்கு. So அப்போ நமக்கு clarity இருக்காது கண்ணுல. It is basically like looking through a waterfall. When the waterfall, how do you look through the waterfall at an object? அது மாதிரி இருக்கும். So that is cataract.
Nice, doctor. So who has risk for cataract?
So it is a normal process.
Is it age?
எனக்கு வரும், நீங்க also வரும் when you grow older.
Okay, that's what I'm asking. So age related.
So age is the most common factor for cataract. But chinna porundiki also cataract. So there is developmental cataract, congenital cataract. Because of any trauma, adipatanala also cataract vara chance irukku. Patients who have diabetes or any other metabolic conditions, ungalku konjam seekirama cataract varum.
Good, doctor. So what are the different types of cataract surgery? When you say different types of cataract is there, so surgeries also will be different, right?
So cataract surgery is almost the similar type. We have something that we call as SICS, that is a small incision cataract surgery. And one modified recent cataract surgery, phacoemulsification cataract surgery. And the latest one is femoral laser surgery. So these are like 2 to 3 sides of the same coin, if I can call it. the end result is almost the same. Of course, the outcome varies because the incision, நம்ம cut எது எடுத்துட்டாங்க to remove the lens. In SICS கொஞ்சம் பெருசா இருக்கும். In phaco சின்னதா இருக்கும். And in femto it's even smaller. Okay, so that is the advantage. So after the surgery, கொஞ்சம் power வர chance இருக்கும் because of the cut. அது கொஞ்சம் கம்மி தான் இருக்கும் in advanced surgeries.
Thank you, doctor. Another question is it must to undergo surgery for cataract, or is there any other alternate medicine for this?
So, as such, there is no alternative medicine for that. And eventually, once you have a vision problem, everybody has to undergo a cataract surgery. For a particular time, once the cataract starts, we can manage with the glasses. So, kannadi potita adu konjam clear na theriyum. But after a point, kannadi also works agada. So, appo nama surgery.
Appo surgery must do not.
Yes.
Good. Okay. The next question is, what is glaucoma?
Yes. So, I said that is the second most common cause of vision loss in elderly people. We call it as a silent killer. So, as I was explaining, glaucoma can be because of increased kanna pressure. So, kanna pressure konja adhikama, or blood supply to the optic nerve. Adu kanna le naram irkom. Adike suppose blood supply kami irkom. Because of both these things, we can have a problem and changes in the optic nerve. Okay. So, at that point of time, nerve le konjam damage aayite, nama vision loss konjam. So, how do we know whether there is a glaucoma or not? After the age of 50 years, kandipa ellarki every yearly kanna check up pananum, retina check up pananum. Also, ninga family le yariki history irko glaucoma ki, amma appa grandparents yariki. So then you have a strong predisposition to have this. So early age, at the age of 30 years also, you can go and you can get yourself checked for that.
Nice explanation, doctor. What is peripheral field loss?
So, as I was explaining, normal when we are looking straight, we can even see what is happening in this entire field, right? Okay, it is a 270-degree field that normal human beings have with both the eyes open. So, glaucoma the peripheral field coming till you can see only one central tunnel vision. So, that is peripheral field loss, that you can't see anything in the surrounding area and you can see only straight.
Okay,
so that is
a problem for the driving.
Yes. So when you're driving, you will not be able to appreciate the rear view mirrors as clearly as you would have been appreciating it before.
Nice, doctor, nice. What is the common problem in retina?
So in retina, one of the most common problems after the age of 60 years that we see is macular degeneration. So what is the macula? Now, retina and macula. Macula is responsible for the central vision. So, adale cell damage, there is lack of blood supply in that area, and the central macular damage. Many causes for that. One of the most common causes is age, smoking, exposure to ultraviolet radiations, and poor food habits.
So, what's your advice then?
So, the advice for that is to eat healthy, to wear protective glasses, ultraviolet ray sunglasses, of course. You have to increase the intake of antioxidants, vitamin C, zinc, proteins in your diet in order to prevent this. Of course, regular health eye checkup goes without saying.
So this is after certain age, is it?
Yes, generally after 55 to 60 years of age,
so
this can happen, yes. So that is one. The second common problem that we see is a retinal detachment and diabetic retinopathy. So retinal...
Yeah, that's the next question. Right. So you started, please go ahead.
Please.
Yeah, that is what, diabetic retinopathy.
Yes. So what is diabetic retinopathy? The chakrane program. Okay, so that's nama ellarku theriyum. Okay, it affects most of the organs in the body. Nama kidney, it can be your foot. Everything can be affected by this. So kannaki also rumbo damage, and this is again a second silent killer.
Oh.
So adale normally because of sugar in the retina, blood supply is reduced to the vessels. So adale nama blood supply, if blood supply is reduced, then what happens is your body tries to compensate. So adale ella new blood vessels varum, and there will be bleeding in the eyes, there will be a lot of damage to the retina. Okay, and we will not realize till it reaches one particular stage. Okay. There is a study which says that almost 80% of people with diabetes mellitus over 20 years of age are affected, over 20 years of duration, are affected with diabetic retinopathy. So, Kandipa, that is one important thing that needs to be taken.
So if you want to avoid diabetic retinopathy, first you have to control your sugar level.
Yes, you have to control your sugar levels, but many people, even with controlled sugar levels, who have more than 20 years of duration of sugar, can have diabetic retinopathy. But yes, controlling sugar is the first thing, lifestyle modifications is the second thing, and regular checkup again.
Nice, doctor. Nice explanation. What is retinal detachment?
So retinal detachment, basically, our retina is attached all around in the eyeball. Okay, there might be some weak areas retina there. So suppose anginda yedo adipattacha or any other conditions we have, appo retina anginda cut down and pull out. So once retina, so on the fluid ella and symptoms of retinal detachment would be your next question, I guess.
Yeah, that's all.
Right?
Yeah.
So retinal detachment signs and symptoms is many a times you'll see nariya flashes of light in the periphery. Like when the torch light yaar put it on the side and the madri feeling varum. Second is floaters. Okay, so nariya poochi madri kannulle fly aayirke adu madri feeling avum. And also nariya black spots. So karpa spots suddenly nariya varum adu madri feeling avum. Also kannu paarvu konjam kammiyagum mangla theriyum. All these are the features of retinal detachment, and those are red signs and red flags.
But what's the cause of this detachment, doctor?
So, there's a primary retinal detachment and secondary. Primary, it could be because of some weak spots in the periphery retina, any retinal holes, or something that we call as lattices. Secondary can be because of anything like trauma, adipatanal, or diabetes, or because of any traction in that particular area of the retina. So all these are the signs, all these are the causes of retinal detachment.
Nice explanation, doctor. What is retinal degeneration?
So retinal degeneration and macular degeneration is almost the same. Retinal degeneration normally happens in the periphery and macular degeneration central level. Many people have retinal degeneration by birth in the periphery and that is not significant. That does not cause much problem as such. But age-related macular degeneration like we just spoke about, that is something that is worrisome.
Nice, doctor. Now I'm coming to your specialty. There's a question, what is eye cancer? How to rule out in early stage? And what are the causes?
Okay, so eye cancers nariya type la irukum. One kan ulla eye cancer irukku and one kan pakatla eye cancers irukkum. So kan ulla cancers நம்ம retina in the start ஆக chance இருக்கு and most commonly அது குரண்டல்ல common இருக்கும். So that is the most common sign and that is something that we call as a cat's eyes reflex. So cat eyes எப்படி இருக்கும் night time ல கொஞ்சம் shiny bright yellowish இருக்கும். But நம்ம கண்ணு நார்மலா தான் இருக்கும் இல்ல?
Yes.
So suppose the cat's eye reflex or குரண்டுக்கு இருக்கும் or children less than 3 to 4 years க்கு இருக்கும், that is like a red sign and you should go and check with the ophthalmologist whether what is there inside. So that is one of the signs of an eye cancer. Second sign of an eye cancer in and around it could be any painless swelling in and around the eyes or kannu konjam velila vara irukum adu madri or any displacement of the eyeball. Okay, so all those are few signs and symptoms, but we have to check with a specialist what it is. All these signs may not point in favor of cancers. You don't have to worry about it, but you must go consult your doctor to see what is around it.
That is always
yes. Any painless lumps and bumps in the eyes that is not resolving, that is something that should be checked.
Thanks, doctor. Nice explanation. And there is many people ask this question. Eyelid twitch. What is that?
Eyelid twitch. So, ரொம்ப simple terminology ல நம்ம டியூப்லைட் நார்மல் கரண்ட் போயிட்டப்போ எப்படி இருக்கும் அந்த டியூப்லைட் நல்லா பிரைட்டா இருக்கும் பட் சப்போஸ் கரண்ட் மாத்திட்டு போயிட்டு இருக்கு மீன்ஸ் எனி ஆல்டர்னேட்டிங் வோல்டேஜ் ஃபிளக்சுவேஷன் அப்போ ஃபிளிக்கர் ஆயிட்டே இருக்கும் கரெக்ட் so any stimulation from the brain to the muscles of the eyelid if there is any fluctuation or change at the stimulation level okay appo eyelid twitch varum there can be many causes for it mild to severe irukkum so any calcium deficiency vitamin B12 deficiency D3 deficiency dry eyes can also cause this eyelid twitch okay? So all these are the causes of eyelid twitch and consult your specialist for any further
because this is frequent there are many people ask the same question about eyelid twitch and நிறைய பேருக்கு இந்த மாதிரி கம்ப்ளைன்ட் இருக்கு but they don't know what is this சும்மா அதிர்ஷ்டம் luck அப்படி சொல்லிடுவாங்க. That's why I think many people ask this question.
Mild irukona appo edu prachane illa. Severe irukku appo kashtam.
Okay, now, at which stage, age I should go for my regular eye checkup?
So, I would say that before you go to the school, you should go for a regular eye checkup. So that is the
Particularly if there
most
is any family history. Is
No, not just that. Nariya time before going to the school, we do not know the children have any vision problem, refractive errors, kannadi prashna edu irukka illa. If you pick it up early, appo in the later stages we can prevent any other thing from happening. So adanal first before going to the school, before enrolling your child to the school, kandipa kannadi power checkup pananum. Second is if any family history of any eye problems like glaucoma, retinal detachment, or any retinal degeneration that we're talking about, நம்ம regular தான் eye checkup க்கு போகணும். Okay. Third thing is about the age of 40, you must go for a regular eye checkup. And fifth, if you are a diabetic, kandipa you have to come for a yearly retinal evaluation.
how frequently, doctor? Suppose if you have patients diabetic, how frequently he has to go for a checkup?
So about 5 years duration of diabetes, you must go every year. Every year we must go for a retina checkup.
Nice, doctor. Another common questions that many people ask: safety measure to keep your eyes safe.
Okay. So your eye safety starts from maintaining a good eye hygiene. Okay. Eye hygiene includes good food. So increase antioxidants, good amount of green leafy vegetables, zinc, vitamin C, vitamin A, increase panana. Second is do not keep frequently rubbing your eyes. Third, ipo ரொம்ப common. எல்லார் பேரு அது மாதிரி போன்ல ஸ்டார்ட் ஆகிட்டே இருக்காங்க. So avoid and reduce your screen timing. Okay, blink your eyes more frequently. If you are a software person, you have to sit in front of the system. We follow a rule of 20-20-20. So every 20 minutes, take a break for 20 seconds and look at 20 feet away. Blink your eyes more often and make sure that there is no reflection on your screen. So that will reduce the eye strain that you have. Very important, wear protective glasses at workplace as well as when you're going out, they should be UV protected. So in order to prevent any damage from ultraviolet rays. These are the most important things that you must follow, and very important, no smoking.
Oh, that's nice. That's the most important point which everyone should follow. Thank you, doctor. Is there any food which we should avoid? You said to follow vitamin A, all those things in the food. But is there any food which we should avoid to keep your eyes safe?
So it depends on the condition. Obviously, if you're diabetic, you will avoid all the foodstuffs which increase your blood sugar in order to prevent diabetic retinopathy. Second thing is, nama highly saturated foods kunja avoid panana, like butter, cheese, and all of that kunja avoid panana. And again, like I said, smoking a total no, and preserved foods. Tinned foods, preserved foods is better to avoid. Have fresh meat or fresh whatever you eat as compared to preserved foods.
That's nice. There's a question now online. I would like to know gas pose can be raised. As I was told, it is max level.
Gas?
Pose.
I'm not able to understand that question. Gas.
Yeah, Mr. Kupuswamy has asked this question. Maybe.
Is it about the intraocular gas that we are putting for retinal detachment, or what is it that?
Maybe we'll go through that question. We'll call that person and find out that.
Sure.
What are the general issues in eye? This is a common question which everyone, I think many people ask the same question. General issues, ailments in eye.
So general, most of it we've covered for the elders.
Yeah.
Okay, in children, it's a refractive error, means kannadi power. Adu correct check pannaliyana, it becomes generally nama kanna vision 100% irukum. But suppose nama refractive errors check pannaliyana, appo one eye dominant one eye kunja lazy eye, weak eye. Okay, so appo that is something that can be corrected with glasses. So that is one thing. Second thing is dry eyes. It's a common issue because of digital eye strain and everything. So if you follow all the modifications that we advise to you, you'll definitely be able to avoid eye strain. Third thing is because of again digitalization and using more system, a lot of eyelid infection is happening because of constant rubbing of the eyes, excess strain of the eyes. So adile nama meibomitis solra and chalazions, recurrent chalazions and styes varo kanle, repe infection. That also can be reduced by reducing and maintaining a good eye hygiene and also reducing your screen time. And last but not the least, I think we've discussed most of it, but cataract is the next most common thing that is there. So yeah.
Yes. Thank you, Doctor. You discussed a lot about the questions which are raised from the public, and so almost you covered all the questions. Is there any general advice as a doctor from you to keep your eyes healthy? There's a general tip.
Yes, so a few tips nowadays for everybody, let it be 3-year-old children to 60-year-old, reduce your screen time. Limit your screen time, even if you cannot. Maintain the rule of 20-20-20. Take break every 20 minutes for 20 seconds and look
20 feet.
away, 20 feet away. Yes, correct, you got that right. Second thing is lid hygiene. Okay, do not frequently rub your eyes. Avoid touching up elsewhere and then touching your eyes. So that is the lid hygiene. Very, very important to eat healthy. Have a balanced diet because that's not just for your whole body but also for your eyes. And frequent eye checkups. Okay, we neglect it a lot, but that is something that has to be made mandatory.
We covered most of the general and common complaints, which the question arises from the common public. Thanks a lot, Dr. Sonam, Nisar. Thanks for coming and join here with our Healthabove60 panel.
Thank you. It was my pleasure to be here. Thanks a lot.